In the last 15 years, my career in science has transformed me from an early career researcher into Grünenthal's head of drug discovery engine. I'm still exploring the latest science as part of Grünenthal's international research team. I'm still working on one of my first projects, and I'm still deeply inspired by the potential to make a positive impact on patient lives. Statistically, the odds of a substance eventually becoming a medicine are very small. But I was always excited by the idea of taking a tiny molecule and designing it to have a very specific positive effect in a system as complicated as the human body. That is what attracted me to pursue a career in science, to become a chemist. I wanted to solve challenges with big potential to making the world better and helping patients in need. Today, I lead an international team of scientists that identifies high potential drug candidates and optimizes and investigates the most promising molecules to get them ready for clinical testing. Drug discovery is a high stakes and very complex task. A chemist by training, I grew from being an individual contributor to a given project to become a project lead. As project lead, I was able to learn an incredible amount about the drug development process and all associated workflows. At the same time, I made my first steps as people manager. Today, I benefit from these experiences in two ways: in managing my team over 30 people and in discussions with project managers about how my team can best support them. My career at Grünenthal has been closely connected with our research into a glucocorticoid receptor modulator. I was allocated to this project at its humble beginnings, while I was at an early stage in my career eager to take over my first project, and I'm still working on it today. In the meantime, when we have already successfully wrapped up clinical phase 1. A lot has changed over the years in our team and in the relevant science. But I make sure no knowledge gets lost, and I want to carry on until we see the true benefit in patients. Carrying a project through the R&D process includes highs and lows, and going through the challenges within your team is one of the most important aspects. It is unusual for a scientist to go all the way from postdoctoral research role to a senior leadership position within one company. It is even more unusual for a scientist to stay on the same project from very early research to later stage clinical development. I'm very grateful and proud to have had the chance to do both. I never wanted to work in any other area. This is the job where my skills and knowledge make the biggest impact. I feel useful and I feel motivated to keep pushing for success, making the world better and helping patients in need. I'm Florian Jakob and I'm proud to work for a world free of pain.